Welcome back. Health experts want to make sure families and their children don't get behind on their vaccines and regular checkups during this pandemic. ABC4's medical correspondent Saray Chin talked with a pediatrician at Intermountain Primary Children's Hospital.
I was really nervous because I didn't want to go in, but this was a specialist appointment that we had scheduled out 3 months prior.
Michelle Jameson, a mother of 4 from Bountiful, was getting concerned as her daughter's doctor's appointment was approaching, until she realized she could do the initial appointment virtually.
The doctor was just there. He popped up on the screen. We had our appointment. There were no other distractions, which was really nice. And then we were done. It was in and out and so quick, and I didn't even have to leave the house.
But anxiety crept back in when the doctor said Haley needed her blood drawn. She asked a few questions, and the answers she got back put her mind at ease.
So I called the lab before we went in, and before I even got to a person on their message, they had told everyone that they are not testing COVID patients at this location, and it just eased my fears knowing they're not testing there, and I can take my daughter, and we can be okay.
Medical providers for children are there for families to help navigate care, and that there are really critical preventive cares that need to take place to make sure we're keeping kids on the right trajectory for their health.
Dr. Neil Davis, a pediatrician at Intermountain Healthcare, is the medical director of pediatric community-based care at Intermountain Primary Children's Hospital. His main message is don't put off the vital checkups, vaccinations, and mental health checkups.
We talk about vaccines. We also talk about mental health screenings, vision screenings. These things really impact not only health right now, but years into the future for a child or a teen. Vaccines are one of the most important things that have gotten a lot of attention, and that's very appropriate. If we get below certain thresholds of vaccine penetrance in a population, that can create opportunities for an epidemic to follow the pandemic we're in right now. And I don't think any of us want to go to that place.
Dr. Davis says it's also critical we check in on our teens' mental health during this time.
There is appropriate concern about the mental health of our preteens and teens right now. It is not easy to be in a developmental stage when you're supposed to be reaching out to be able to, to be forced in some senses to be isolated. And that can turn into a spiral that's really challenging. So I would really encourage parents to watch for signs of further isolation.
Haley, I want to ask you, you're 13 years old. Were you nervous going into the lab?
I was terrified.
Yeah.
More because she was getting blood work done and less about COVID.
I see.
It's really not as bad as you think. You should just go for it.
Everyone seems to be really on high alert as far as sanitizing things and making sure everyone has masks and gloves when we go places. And we also do the same in wearing our masks when we go out.
So what would you tell other moms and dads or other patients who were concerned as you were in the beginning?
So I would definitely be proactive and call. I was so grateful that the lab had that message before I even got to a person that they are not testing COVID patients at that location. And I think just being alert as a parent and knowing what you are comfortable with, and then making sure that those health agencies or whatever you're visiting are up to your standards. And so many of them really are.
Saray Chin, ABC4 News.